For the time you blessed us with today, may we be sensitive to what you'd have us to lead the Cherokee people with. May we use discernment, and we just ask for wisdom as we make decisions going forward. In Jesus' name I pray. Amen.
Amen.
Shelley, would you like to do a roll call?
Mary Baker Shaw.
Present.
Mike Bobbin.
Here.
Will England.
Honey.
Chris Boston.
Here.
Carly Buzzard.
Here.
Joe Bird.
Honey.
Sean Crittenden.
Honey.
Ricky Hargis.
Present.
Wanda Hatfield. Honey. Rex Jordan.
Here.
Dick Lay.
Honey.
Mike Shambaugh.
Here.
Leo Smith.
Here.
Denise Taylor. Here. Victoria Vasquez. Dave Walkenstick. Brian Warner.
Honey.
We do it.
Thank you. Thank you. Is George here from Claremont? Oh, George. Hi. You want to start with the report today for us? Good morning. I think we've got an echo in the room.
Yeah. We need to approve the minutes.
Oh, I'm sorry. Yes. Has everyone read the minutes as written?
Second.
Motion's been made, seconded to approve the minutes. All those in favor say aye. Sign. Okay, minutes have been approved. Okay, George.
Can we turn this off or something? I can't hear it.
They're working on it. They've motioned to us.
Maybe they could turn it down.
Unplug. I thought it was just me.
I thought it was my allergies.
Doing all right?
I thought it was just for medication.
If you're waiting for it on. You'll be there, won't you?
Who's that right there? Oh, thanks. Okay.
Yay. Thank you.
Is that better?
That's much better.
Much better. Okay. George, good afternoon.
Good afternoon.
How are you?
I'm good. I'm good. I'm good. St. Francis in Tulsa has asked that they be allowed to come over to Claremore and provide children's hospital outreach education. It's provided on site and is conducted by a neonatologist, so we can work close in hand with them. We had several nurses attend the OU College of Nursing Evidence-Based Practice Symposium in Tulsa. We are trying to get the, I don't know, you may not be aware that the east wall on the hospital has begun pulling away from the structure. So there's a couple of inches there that it's pulled out. We've had engineers come in and it's stable. Now we're looking at ways to get that wall pulled back in to the structure. So we've had a contractor on site, gave us a couple of estimates, putting some giant screws down into the ground and tightening those up and pulling that wall back up, even with the building again. So that'll be on the horizon here in the next couple months. We had a meeting with the GAO, the Government Accounting Office. They stopped by a couple weeks ago. They just had some general questions, kind of follow-up questions about the IHS VA Memorandum of Understanding, and we had a good visit with them. We also had, actually the same day, we had a group of healthcare workers from Angola, South Africa, stop by on their tour through the United States and visited with us, mostly public health questions on our part. So that was a good visit. We finished that up with a tour of the hospital. The emergency room is still moving forward. We're just about finished with the design part of the design and build. Once they start The build portion, I think in the contract, it says they have 150 days to complete the remodeling part. We're doing an air conditioning replacement project over on the administrative side, on the administrative building. Our point of sale billing clerks have been going back and working projected claims from insurance companies on point of sale for our pharmacy and medical reimbursements. We have acquired a new anticoagulation clinic provider. And we have one of our pharmacists, Captain Lisa Becker, has been working with Dr. Bishop on a 6-week educational program on the power of belief, genetics, and health. Nursing's had a on-site class for fetal health monitoring. It'll be May 21st and 22nd. We just had a big celebration for Nurses Week, and we are due again for our baby-friendly recertification survey. Recertification survey, yes. We added we replaced the 2 Parata robots, the refilling robots in pharmacy with 2 new Script Pro robots. And the other thing she made sure that I brought up was 3D mammograms are now being performed on all screening mammograms. So some highlights from Claremore. Any questions about that?
Yes, Counselor Taylor.
Okay, so we're still short one OBGYN.
Yes.
How many do you have on staff? Bottom line is, we had, 32 babies last month?
Yes.
So, do you have one OBGYN that's on call 24/7, or
They rotate call.
how many do we have?
We have three right now.
Okay, so you're still well covered. Okay, all right, that's all I have.
Any further questions? Yes, Counselor Buzzard.
George, I want to make sure I'm reading your numbers right. On the first page, patient visits are down. And over there you've got CN written, 12,873 patients. And then to the side of that, 6,017. That's Cherokee Nation patients.
Yes.
Is that right?
Yes.
So 50% with Cherokee.
Yes.
Okay. I'm here. Thank you.
Yes, sir. Any further questions for George? Thank you for joining us today. We appreciate it. Next, we'll invite Dr. Charles Grimm from Cherokee Nation Health Services up. Good afternoon, Dr. Grimm.
Good afternoon, Chairwoman, council members. Appreciate being with you today. You should have received late last week our most updated recruitment report. I'll say a little bit about it, and if you have any questions, our head of that department, Stephanie Wycliffe, is here and can answer some detailed questions if you'd like. Pleased to say that we have a physician that signed last week for Oshaleta. And once that's processed, it'll begin, that person will begin in August. We also have 2 other folks that we're recruiting right now that hopefully probably early fall before they might be able to be on, but we hope to be able to get that facility fully staffed, and hopefully they'll be there for some time. We were interviewing for Salina and Muskogee, a provider, and they notified us this morning that she selected Muskogee, and we'll be issuing them a letter of commitment today. Our 2 new physicians for Jay, we're going to be on board August the 5th and September the 1st. And then we have a NOATA physician that will start at the end of July. At Hastings, we have a full-time physician in urgent care that will be starting July 15th, and we've been busy interviewing several surgeons, with one on site today being interviewed. So that department has been very, very busy, and very excited to get to talk about those positions that are coming on board full-time. If anyone has any further questions about that, I would either take them or ask Stephanie to join me.
Any questions? Okay.
I'm just going to mention one or two quick things, and then I'll open things up for questions. Last week was Hospital Week and also Nursing Week, and we had a number of events for our staff, those at the hospital, and then Nursing Week planned throughout last week. So it was a nice week and a fun week to honor all of our people that work at the hospital and also all of our nurses across the system. The chief signed resolutions celebrating both those events in the Cherokee Nation, and just so you know, I had to look it up, but we have 450 nurses on staff out of our 2,400 budgeted positions. So it's a large percent of our workforce is nursing, and I think most of you realize the care they provide helps make people either feel they've had a good experience or not, but nurses do a lot throughout our whole health system. One quick mention that I don't believe is in your report this month is that we are in the architectural design planning phases to replace the old side of the Stillwell Clinic. You know, we did the expansion on the, to the east there and added primary care, imaging, and lab primarily into that side. The programs that are left on the other side, we're going to be designing expanded space for all of those, and as soon as we have the plans ready to go and have a rough estimate of when we would start construction, we'll let you know that. But we're very excited about that too. That new that renovation, if you will, or that new construction will essentially make our Wilma P. Mankiller Health Center all brand new again, and will mimic a lot of the furniture, fixture, and equipments on the older side for what the new side looks like. So it'll look very consistent and the same, and it's going to be really nice. So those are all the updates I'm going to give right now since you have our report, and I'll be happy to take any questions.
Councilor Crittenden.
Dr. on the same note, so the pharmacy is going to be able to stay on site?
We're working on that right now. We're looking at some space in town. We're also looking at some space perhaps across the street for modular units. And we're being very sensitive to trying to keep pharmacy either on site or as close as we can. We're hoping that perhaps the furthest they might have to go would be across the street, but right now it's still too early in that planning phase to be able to tell you exactly what will happen.
Okay,
You're talking about the parking lot at those Tysons.
that'd be great.
Yeah, we put some modular units for some of the other programs that wouldn't fit.
That'd be great. And also had not very many calls yet, but I anticipate some as far as maybe helping the folks get to Salisaw or Tahlequah. Not everybody will need a ride, but some will. I know we have Sooner Ride, and the Cats do some. And are you looking at anything else for the folks who maybe don't qualify for the?
That is on our list of planning items to try to take care of. I know that facility is also asking for an additional transportation vehicle. Stillwell is, but one additional vehicle is not going to take care of all those needs. So we're seeing what we can figure out to do internally with existing transportation, in addition to those ones you mentioned, to try to be able to help people. We're hoping the only one we know right now for sure that is not going to be on site is dental, and so hopefully most of those other programs that are in there might be able to be relocated, either into the new side or into one of the modular units, or should we rent building space and still be somewhere in town. If there's another one that ends up being out of town, then we're going to work on that as well.
So the one that they're wanting would need to be specialized for wheelchair and different things.
Yes.
Just in the time being, maybe a surplus vehicle that, once you look at the dental folks that maybe need help with the ride, would you want me to kind of look at the surplus side of it, or do you visit?
We can do that. I'll do that so that you don't have to, but if something falls in your lap, let me know. I'll tell you that Health Administration has given up all of our government vehicles to Stillwell right now in the time, you know, that they have this need. And, you know, whenever we have a special need come up, sometimes, you know, when we get a phone call, we'll call Hastings or Muskogee or somebody and see if they can fulfill a short-term, you know, need. But if we're going to need a lot of stuff for long-term, then we're going to have to try to do something else.
You guys been, Michael Lynn, and you guys on the different individual need, been real good about helping. Also, Doctor, I think this is the right place. We had some success, I would say, with the survey, and did a work group here recently, and I'm proud of that. Get a lot of calls about the dental department, and I would like to form a work group. We can discuss and maybe get some answers that way. I'd like to head that thing, and I've got some folks in mind, but I guess we just take volunteers who would like to be on that work group with me.
So if I understand you right, Councilor Crittenton, you'd like to form a work group, would it be council members?
Yes.
Of council members regarding dental services?
Yes.
Okay, do we have any volunteers for this group?
I will.
Thank you.
Councilor Buzzard?
Yeah.
Councilor Lay? Councilor England?
Dr.
Okay.
Dobbins?
I just want to, if I could make a
Sure.
comment.
Councilor Dobbins?
Councilor Crittenden, if this was,
It's not really survey.
I know, is there a need that this, you feel like there's a need to
Yes,
get this done?
for a while.
Okay, all right. I'll talk to you privately about it. That's okay,
Okay, would you like to be a part of it?
possibly.
Yeah.
Just hear what,
Now, you're a dentist, right?
I am. Don't hold that against me.
Well, I'd sure welcome you, and go ahead and put David Walking-Stick down if you would.
Certainly, and Councilor Walking Stick?
Is he in the room?
He's
right there.
through that glass. I can take time to ask him.
I think he needs to be the one who says that.
Thank you, Keith. I got my rule book.
Yes, me too, Shelley. I'd like to sit in on the committee. Feel free, Councilor Crittenton, feel free to invite Councilor Walking Stick to join us.
He said yes.
Okay, wonderful.
And Doctor, one of the things we might have to work through the group, but I'm wanting the dental assistant pay scale, career ladder. Just if you take a job, kind of know your options, how you can go up, what it takes to go up. And I hadn't been able to get that so far, Doctor. You can let me know if you can get that for me, or if the work group, that's one of the things we can discuss. That's all I have. Thank you.
Thank you. And Councilor Crittenton, will you be in touch with these members about a meeting?
Yes. So I'll write that down. Harley, Bill, Dick, David.
Wanda?
Okay.
Wanda?
Wanda.
I had a question about it.
Oh, Councilor Hatt, yes.
I mean, can I be on that committee? I mean,
Yeah.
being at large?
Sure.
That doesn't make
Well,
a difference? Okay,
I'm
that
good.
was my question.
All right.
That's-
Thank you. I'll be in touch.
Okay, thank you, Councilor Crittenton. Okay, anybody else have any questions for Dr. Green? Yes, Councilor Taylor.
Since you brought up dental, I was just going to kind of give a shout out to Dr. Jones and his staff at the clinic in Salina. Just this last week, I've had 2 different people brag on Dr. Andrews, I think it is. So we're fortunate up there. I did have a couple questions on the financials. Is Amy in the office this afternoon?
She is, I
Okay,
believe.
I'll just email her
Okay.
because it's nothing that really bothers me. I just want some clarification. I think I'll get it done with her. That's all I have.
Thank you. Anyone else have any questions for Dr. Grimm?
I have a comment.
Yes, Councilor Byrd.
Dr. Grimm, on our new joint venture, would you give us an update, maybe next month sometimes, on how much money we've drawn down from the millions of dollars we did the line of credit? And just give us an update on where we are as far as
Okay.
progress of the facility.
Okay, will do.
Okay.
Short is we're either on or slightly ahead of schedule and under budget, but I'll give you more details later.
Okay, good. Thank you, Madam Chair.
Okay. Councilor Shambaugh.
Dr. Graham, would you be available for 5 minutes after?
Yes, sir.
Thank you.
Any other questions from the council? Okay, I have a couple of things I'd like to share. I want to thank Dr. Grimm for taking time from a Saturday morning to visit with me regarding concerns I had on echocardiograms and 30-day Holter monitor event testing. And I appreciate your investigation into the cardiac test that we discussed, and I look forward to you getting back to me on what you find out about that. And I'd like to comment. I noticed that on our ambulatory care visits that every one of them are down except Oshaleta on ambulatory patient visits for the year compared to last year. What do you attribute that to?
You know, I don't have anything to attribute it to right now. I mean, it's month, you know, this particular month compared to last year, and so we're going to have to look at that closer, but I noticed it as well.
It's interesting. Hopefully it's quality patient care.
Yeah.
Not quality patient care. Dr. Grimm, I had a couple of complaints from the Muskogee Clinic about a physician who has taken, I guess, leave of absence. But the patients have received no notification on the cancellation of their appointments, and they have shown up without a physician to see them and no medication availability to them. What can we do to improve that?
I will make some phone calls just right after this meeting and see what we can do with any of the people that you know, we're supposed to have medication refills. Usually that we can get fixed pretty immediately. And you know, if it wasn't done when they showed up at the door, then we'll take care of it. And we should have notified them unless it was just a very unexpected short notice thing. They should have been notified in advance to either reschedule or at least, you know, let them know that their provider was not there for that day. So
we do have staffing available at our clinics who will notify our patients in the future of a change in their schedule.
Yes, we'll reiterate that to all of our staff that do that.
Very good, very good. Okay, I want to ask you a question. On if I went in to have an an EKG, and I wanted a copy of that test, say in a couple of weeks, could I go in and just request that, and would it be available?
If it had been completed and read, yes, you can request through your medical records request to have your records released to you.
How long should that take to receive those records?
If you're asking for just one item, usually it's pretty quick unless they're backed up. If you're asking for a whole big record, you know, that sometimes takes a while.
It's my understanding. I've got two citizens or patients of ours who have messaged me that they have had problems in getting copies of their EKGs.
Okay. If you feel comfortable sharing their name after this with me, I can research that.
Certainly, I'll find I'll get their email. Okay. And that's about all I have. Do any of the other? Yes, Councilor England.
Yes, I'd like to personally thank Dr. Grimm for a couple of issues he's helped me with here lately, and one of them is life-threatening, and I really believe that the lady is it's gonna work out great for her. And
good.
I mean, Dr. Grimm has jumped through hoops to work with me on it.
Thank you very much.
I appreciate it. Thanks a lot.
Dr. Grimm, I know we have an interim director. What's his title and what's his name? Could you share that with the council?
Medical director, Dr. talking about executive management. I think he's here too, and I was going to introduce you all to him. I'm glad you brought that up. Dr. Doug Nolan, he's going to be our new executive medical director. He's been in that role for about four weeks maybe now. Dr. Stalkup, as you all might remember, was our CMIO prior to taking that executive director role as interim. And we have him back there now. There's a lot of issues with our medical record. CMIO is Chief Medical Informatics Officer. That was his role prior to coming in. He'd been in that role for a while, but we pulled him out about a year into the Cerner rollout. And there have been issues that, you know, we have to continue to work on. That's just the way it will always be. And so he's back there working on that now, and I've asked Dr. Nolan to step in as an interim executive medical director for us. He's been in that role before in the past. He was also the former medical director for the hospital for many, many years, and he's worked in our system. I was going to ask him before I got started, how many years, Doug, have you been working for us?
15 years.
15 years.
Wonderful.
So he knows a lot of people, knows all of our physicians and a lot of staff, and is already doing a great job at working on the issues that we have at this level. So in the future, I think most of you know about it now, but occasionally I'll still get an email, you know, with Dr. Stalkup. I always forward it to Dr. Nolan quickly, try to let you all know that too. But in the future, if you have any issues relative to medical director sorts of concerns, feel free to email him directly or to he and I both, or just me, and I'll get it to him. So.
Okay. Yes, Councilor Crittenden.
Dr. Nolan, what is your email address?
It's Douglas, that's Douglas hyphen Nolan, Nolan, at Cherokee.org.
Cherokee.org. Thank you, sir.
And I did send an email to Gail, I believe, that has his email and cell phone number on it, and that's so he doesn't have to mention his cell phone number to everyone that might be watching this. You all should have that, and if you don't, or you've already deleted it, let me know and I'll get it to you.
Well, Dr. Nolan is a blue chipper. He's been around for a while. I've known his family, and we taught school together at Stillwell High School for over 5 years. So,
yeah, former teacher too.
Teacher, too big for the small guards and too quick for the big forwards. So we're good to have him on board.
Thank you. I appreciate him being willing to do this. You know, this is not an easy job. And he could have said no, but he never says no when you ask him to do things like this. So I very much appreciate it and publicly thank him here in front of you all. So.
Very nice. Councilor Bussford, did you have a question?
Yes. Dr. Graham, have you had any calls or about referrals that may have been in the system when Cerner was coming online, that may have been lost, or the providers or the persons they went to see is sending them a bill now because we aren't paying them? And I think it was in the period when Cerner was coming online.
I haven't heard
but
that.
I know that they had referrals.
I hadn't heard it, but it wouldn't surprise me.
Okay.
And if you have a name,
okay,
I'll have our CHS people look into it.
Okay. And I thought that may be the case right there because it was right in that transition period when Cerner was coming online that they may have misplaced or lost a referral.
Because we started a new process with CHS at that same time. So.
And I thought that may be the case. So okay, I'll check on them. I'll get back with you.
Okay.
Thank
If you'll get me the name or names,
all right, thanks.
We'll research it.
Thank you, Madam Chair.
Councilor Dobbins.
Thank you, Chair. Dr. Nolan is also on the faculty at the OSU Med School. He's Assistant Dean for Tribal Medical Education. And recently the OSU Med School had graduation on Saturday, but then they had a separate ceremony on Friday. Maybe Dr. Nolan, you could share what that separate ceremony was on Friday.
The ceremony actually is there to recognize the Native American students at OSU. Dr. Dobbins was there. Very nice ceremony. I think it's nice to see the way the Native Americans and OSU has worked together. They mentioned during one of the presentations that OSU has about a 15% Native American enrollment rate in the medical school, which is a large number ahead of the national average. Mr. Brian Hale actually gave one of the addresses for the students, which was he did a very good job. I think it's very interesting to note also that the outstanding Native American student for this year was a Cherokee, Dr. Sarah Kruchek, which is quite an honor that the Cherokee was considered the outstanding student. So this is a ceremony that they do every year. They recognize the various Native American students they have, not only that are going to be physicians, but that are getting their masters in health administration and also in forensics. They're difficult courses, but we're well represented. I think the Cherokees should be proud of that. Thank you for asking. It was a good ceremony.
Thank you for that report.
Just want to add.
Yes, Councilor Dobbins.
There was 17 natives honored, and I believe 6 were Cherokee. We did have 2 Cherokee graduates. One, as Dr. Nolan mentioned, was the head, and I think she's doing a residency in pediatrics.
That's correct.
In Little Rock. The other one is a student that we sponsored through our directed studies. And so she's going to, I think she may have already started her residency out of Hastings here, just very shortly. Her name's Dr. Passman. And the only reason I mention that, I think at some point maybe we ought to consider investing more resources into medical education, because Dr. Passman is committed to us in a service way, and so we can count on her being here. So that's just a thought on down the road, but maybe an education committee we discuss in the future, maybe dedicating some more resources to medical education. That way we have these strong students committed to us after their 4 years, like this one is now, Dr. Passman. But thank you, Madam Chair.
Excellent point, Councilor Dobbins. Any other questions? I would like to ask you, on the RVU situation, is that calming down? I've had 2 complaints in the last month.
It's not as calmed down as I'd like to see it yet. And we're still working with the staff who have concerns directly. In fact, I was out at one of our clinics, Councilor Taylor, on Friday, and met with the medical director and one of the staff who's had some concerns about it, for some time. So we are still working those out, and we want our reports to be as accurate as they can. And what we've told all the physicians and the advanced practice nurses and the PAs are, if you have any concerns about them, approach us. We have several staff that work on that, and we'll sit down with you and try to help you. If you think we haven't got certain credits, we'll work to either find them or get them added. And as we learn that there are things that we might be missing, then we'll make sure we integrate that into the process. And so you're going to probably still get a few calls for a while. I think it'll stay that way for a while before it gets better, and I do hope it gets better, because we're working really hard to try to, make sure everyone is as comfortable as they can be with this process.
Dr. Grimm, this is going to sound, maybe it's a silly question and I don't know it, but is there like a cheat card that these physicians can have for their RVU coding, or do they have those available?
I don't know about a cheat card, but one thing that we have been doing is making the coders available to actually work with the physicians, which increases their accuracy in documentation. So we're making as much education available as possible.
We are sending out some of our staff out. I think it's on a quarterly basis, which is what we're wanting to do. Try to go to each facility, and anyone there that wants to sit down and talk with them about things, they'll be able to do that. So we're going to do some rotating meetings on site at each location. We'll continue to do that. And I know in that meeting they are handing out, some, or will be handing out some things that talk about some kind of key things to remember and think of, as you're coding or as you're writing your notes. Usually the physicians write the notes, the coders will then use that information to provide the coding for it. And so we're trying to educate, both of those parties, the physician staff and the coding staff, about things. So I don't know that I'd call that a cheat sheet either, but it will be a list of things, to try to keep in mind as you're seeing your patients and you're documenting your visits.
A concern that was verbalized to me last week was someone, I think it was a physician assistant, who had done some coding, and then evidently, I don't know how, there was a problem, I guess, in putting it in, and then they had to go back and spend time to get the correct codes. So I guess if you're correct, what you're saying is they could have called a coder who would have assisted them to get it right the first time then.
Yes. I know our coders have been very willing to talk to any of the providers that have called them, to ask questions. But either way, we'll help them either way. If they've gone back and done things and want to check it, we'll do it that way as well.
I think it's a time issue that they've got to still do their job, and then they have to spend all night trying to research
there are a number
codes.
of them that are still doing that, just to make sure. And I do know that we've been working on a report, and whenever I was at Salina on Friday talking about it, I know we've been working on a report that we may release soon that should make it easier for them to do than the way they're currently doing it. And I'm not going to try to explain it now because I would probably get something wrong, but it should cut down on the amount of time that they have to spend trying to verify every single, thing that's on that report, because it's a pretty lengthy report, and it's got a lot of information on it, and so this is one way to try to make it a little bit easier for them to track. And I think we'll enhance things as we go along. I think we'll enhance things on the administrative side, make it easier for them, and I think those that have had concerns, the more questions they ask, the more meetings or phone calls they have, I'm hoping they get more comfortable about it too, but we're not there yet. We're not quite there yet.
Not quite there yet. Okay, thank you for that explanation. Counselor Lay.
Thank you, ma'am. Doc, how long have we been on the Cerner program now?
I believe it was August of 15, I think.
That's right.
August of 2015.
Do you know how many coders we have that you all have?
Not off the top of my head without, I want to say in the 20s, but I can find that number out for you.
Is there a need for coders in each clinic, or not that I'm asking for extra employees for my clinic? I might.
Some of our coding staff are located in some of the clinics, and it's people we didn't move that were already there, but other of our coding staff are centralized. Because of the way that works, we're able to assign them documents to code no matter where they're located. And so it doesn't always mean that if somebody's in a facility, they're 100% of the time working on those codings from those facilities, those providers. And staffing wise, we're working on the 2019 budget, and that'll be coming to you all soon. And I'm trying to remember, I'm still trying to grasp all the things that all the programs have done. We're going to be able to be a little bit more supportive of some of the needs this year. Our revenue's looking really good at this point in the year. And so for 2019, we're going to be able to add some positions here and there. And I think that department, I don't know if it's specifically around coding, but that department's going to be able to add some additional staff needs that they have, the business office.
Do they have to be centrally located, or is it like a call center? They can be anywhere.
They can be anywhere, actually. I mean, that technology exists for that particular, type of job, which is whenever somebody gets behind, if somebody's off at us that happens to be out of sight, and all of a sudden that particular clinic gets behind from a central place, we can assign, those visits from that site to some other coders to help so that we stay caught up, so that when that person does come back, they're not overwhelmed.
When your nurses, PAs, whatever, whoever needs the coding help, do they pick up the phone, or are they online with that coder, or what?
From my understanding, it's a phone call, not an online chat, but I don't know that for sure.
Usually it is a phone call. They can email, but the coders have actually also been good. If there's more questions to go to them, they can see them face to face.
Does one number go to an open coder automatically, or do they wait and hear that music for a while?
I don't know the answer to that.
I can listen to that music for a while, but I don't know that they have.
Yeah, no, they wouldn't listen very long. I have a feeling before they hung up. So, and rightfully so. Rightfully so, to get back to seeing patients.
If that capability exists to send it to the open coder, could you? Might be worth looking at.
And it may work that way right now too. I don't know, but I'll find out and we'll get back to you.
Thank you.
Thank you. Counselor Buzzard.
Dr. Dobbins brought up a point a while ago about people receiving scholarships and stuff. Do you happen to know, Dr. Grimm, how many director of study program people that we have that's doing health now? It may be a question for.
I don't off the top of my head, but they do send us information about that.
Do you know how many is in a director of study program now?
I don't off the
It
top of
may
my
be a
head.
better question for education over there to answer that question. So.
I do know I saw some emails recently about how many physicians were in the pipeline recently.
I
that
saw
they
one
sent us.
director of study program person on here. And kind of caught my eye.
And-
Okay, I'll check with education and see. He may know the answer to that. Okay, thank you.
Thank you. Counselor Warner?
Yes, ma'am, thank you. And to Harley's point, a lot of times, Harley, that directed studies, I know they'll rotate that out through different, because I was checking on that just the other day. There was a list for 2017 that were programs that were eligible for directed studies, and then they've got a new 2018, so certain things fall under that. But I've asked that health kind of get some priority on that because of the situation that we're in. One thing, while I've got everybody, I thought about doing this a couple different ways, but I think, just, my knee jerk was try to get it in as quick as possible, but also, this has to do with public health and basically kind of making more aware. You all know one of my passions has become the work that we're doing with the CDC and some of the things on that national level, and I've got in with that public health group. And I just some food for thought right now for this group, and we can do this at another meeting, but I'm looking to form a subcommittee of public health and give them some time to come in. That way, instead of, expanding our time here, and I looked at the model that Victoria used for the cultural committee, and she kind of rotates month after month. I would be looking at something like when she's not on cultural committee, that next month, you slot public health into that as a subcommittee. And some of my reasons why, public health, just personally, when you look at getting healthy, there's not enough time in the day when you're busy. So therefore, me personally, I've had to get up early. Got the kids to take to school and everything, so I get up early. Well, in turn, I'm getting healthier, but I'm also going to bed earlier. You know what I mean? So it started that domino effect that I can see that if I don't go to bed early enough, then it's hard to get up in the morning. It's choices. It's choosing water, okay? So then I think, well, I want to take this water instead of this pop or instead of Gatorade. At our house, it's a big struggle, Gatorade versus water. Gatorade has a lot of sugar in it, even if you get the G2 or whatever. That choice then leaks over water, or do I go buy a container? Some of the things that I've seen the healthcare that already do, and I know that Lisa Pivington has already talked to Dr. Graham about this public health. The return itself. For every dollar, you get $5 in return. That's 5-to-1 odds where I come from at the racetrack. That's not bad return. And that national presence, folks, there's money out there, and right now there's kind of this battle between, you have these TECs, these tribal epicenters for areas that are like reservations. Well, we're accredited, okay? We're the only tribal public health accredited tribe, all right? So there's this thing where if you're out on a reservation, those epicenters, they work really well because they don't have the infrastructure that we do to dole out that money. Well, right now those epicenters are trying to grab up more money, where we as Cherokee tribes and the Chickasaws and some of the others in Choctaw, country, we would like to be able to dole out our own money, get our own that we want, and that way we could put it better fit. So you've got this going on right now. The epicenters are lining up on their side. The tribes are coming together. And what I see is you've kind of got this fine line to draw. We all supposed to get along. You know what I mean? But this is public health. And it starts to touch and it starts to weave a web throughout, whether it's environmental or whether it's a personal choice or whether it's a national presence. So, I'm just trying to make a stand right now, and I'll come back to you and I'll formally do that after I talk with Dr. Graham, Lisa Pivick, and you guys have been introduced to these folks, and Dr. Gann and Dr. Comerford through the survey process, and they're an A-team that we have out there. And I hear all the time, I get a lot of phone calls about, hey, can we open up that Redbird workout room a little longer? Hey, can we make improvements to Marcoma? That's public health, and that public health has to be at the top. Everything else draws from there, because in my mind, when I had to make a decision whether I look healthy or not, I know how I feel. And I've got 3 boys, and I'm hoping that they go out and have grandkids, and I want to be able to run and play like I do right now with those. So that's kind of the choices. And I applaud our efforts in the clinical side. We've built the infrastructure through the current administration, and we've done all these things. But for future generations, it's time to plant that seed of public health so that that shade can be seen and felt for our future generations, whether that's 7+ on down the road, if we don't start right now. And that's all these services that we already currently do. I just want to make that
more aware of what's going on, then that gives us a forum to say, well, hey, in my town, I've got this many folks that they would love a 24-hour fitness facility. How can we make this work? Do we team up with our community groups out there, and do we help them build onto their facility and ask them to manage a workout facility? I mean, there's just all kinds of ideas that everybody could think of, but I just want to bring that to your attention, and I'll be bringing that to the next health meeting. That way we can formally do it. And if you have any other ideas, positive or negative, I am wide open, so thank you.
Thank you, Councilor Warner. You can tell that's a passion you have.
Yes, ma'am.
Very much. Councilor Buzzard.
I just want to follow up with Councilor Warner. And I'd like for you to write this down. It's on Netflix. It's called Magic Pill. And it calls just kind of what he's talking about. And I guarantee you it will change people's minds about your health and what we can do as a nation. I know we've talked about aquaponics here before. That kind of goes into what he's talking about right now. But if you got Netflix, click on that and watch that documentary. It's really a good one. Thank you.
Thank you for sharing that very much.
I might add that we've had talks with Councilor Warner, and he's represented us well at the national level on that CDC TAC, and we do have one of the best, if not the best, public health departments in the nation, I believe, of any tribe. We are the only tribe that's accredited, and we've talked with Secretary of State about this as well. And if you all choose to do that, we'd be more than happy to work with you on some overarching public health issues, both programs, laws, anything that you all might see fit. The other thing I'll mention about the recruitment issues too, in getting ready for this new facility, we expanded 4 facilities and added approximately 100 positions that year. Not all of them were to those 4, but and it's taken us a while to recruit some of those. We know the new facility that's going to have 800 additional positions, or 800 plus. Plus the expansion that we'll be doing at Stillwell, which will end up with a few new positions in different categories that we're going to need to do work with a lot of people. We've been reaching out, and organizations have been reaching out to us too. But so you'll know, we are working internally with our Career Services Department, with Education Department. IT has been at those meetings, the Tribal IT Department as well, because we're going to need a lot of new IT staff for staffing this facility. And we're looking at what our needs are right now. So we're looking internally and getting a lot of help. HR has been at all those meetings too. The Secretary of State has been to a number of those meetings. I mean, we've had a lot of high-level involvement and a lot of cross-departmental involvement trying to plan to get ready for the opening of this facility and what we'll need. And I mean, HR has gone clear from, tell us what positions are most critical. Do we need to work on new job descriptions for those? Do we need to do comps and get new comps ready, for those new market analyses and all? So we are starting to work internally, but we welcome any input, and Dr. Dobbins has done a lot, Councilor Dobbins, over the years for, American Indian recruitment into the health professions, and we always appreciate him helping us with that and raising those issues. But I want you to know we are starting to work on that, and it's going to be here before you know it. We're saying somewhere between July and September of 2019. We're in May of 2018. I mean, it'll be here when we just turn around, and so we're doing a lot to start getting ready for that.
Dr. Grimm, how many positions are you wanting to fill before that opening?
We're not going to fill a whole lot before the opening of physicians, because first we need the money. We won't get the money. We may get some additional money early from them if approved, but what we do plan on doing is moving the existing ambulatory staff over in total, and we think that's roughly about 400 people that'll move from the current Hastings facility into the new. So we'll be able to operate every department almost the same as it operates now. I mean, we're going to have to leave some lab, some radiology, some pharmacy at the hospital, because they're going to still be there to support inpatient, emergency room, and urgent care. So those departments will kind of split. But there are some staff we really are going to try to get advanced funding from the agency to have early. We're going to need more IT, more housekeeping, more grounds people, those kind of staff that will help us open up early on. So we may open with existing health professionals as is and then start recruiting, but again, we're still in the planning phases of that too. So in several months I might tell you something different than I'm telling you right now. So
Thank you. Thank you. Are there any further questions? Yes, Councilor Hatfield.
Since it's a health committee meeting, I was, and I don't know if this is the appropriate time to share it, but I was recently named to the board of directors of Oklahoma City Indian Clinic.
Oh, congratulations!
And your name was mentioned, and several times. And another thing, I've also been talking to a gentleman from the Bethany Rehabilitative Center, the Children's Rehabilitative Center, and they're very interested in our new facility and the med school, and to work with us. We also met with Secretary Hoskin as well. So, but they're very interested in learn more about it, and it's out there. I've just had discussion with several people that I'm associated with, and they really hear some good. They're hearing good things about our health.
Good. And congratulations again.
Thank you.
That's a good board, a lot of good people. That's a good clinic, good organization.
And they're, they serve, I think, the Cherokees. This is the second largest group, so I think it's very important, even though Oklahoma City is many miles away when you're here, it seems like, but they're willing, they're very interested in us.
Thank you.
In our works, your works. Thank you.
Thanks.
Thank you.
Well, Councilor Hatfield, congratulations on that new appointment.
Yeah.
Yes, absolutely. Councilor Shambaugh.
Just a quick comment, kind of going back to Councilman Warner's, what he talked about. We have a Indian-owned and fitness center in Jay, and I had talked to them earlier on about what would be the chances of people in the Jay clinic if they needed to do a little rehab or they just needed a place to exercise. That is very important. The older you get, really, anytime. But boy, the older you get, I know when I don't work out, it's difficult for me, and I can really tell. But they would be interested in doing something like that, and just finding a place for people to go, where it's structured and they have the equipment to work on is a difficult thing. Spavinaw school had closed, here a while back. They've got some space, they have some equipment. There's places out there, I think, that if you look around, boy, it would be great if the nation, if at some point in time we could get involved in finding a place where people could go work out, because the health benefits of that are just massive of exercise. I think that would be something that we really need to look into, because there are places that are willing to participate with us.
Sounds like a good idea.
It's good to hear people talking about preventive health care here. For monthly reports there, I've always tried to tell everyone that we have close to 10,000 visitors every month at the Wellness Center here in Tahlequah. And then everybody else gets excited about 9,500 visits at Redbird or Wilma Peace. The ones that go to the Wellness Center, those are the ones you won't see in the emergency room. And I know we have to get reimbursed for some of this health care we're doing, but I think this generation here, we need to really, and I'm glad to hear the passion from Warner and the comments that's been made today about preventive health care. It'll create more jobs, it'll create more training, but we have to take the lead in that, because we still have a lot of rural areas out there that do not have the access that we do here, the capital here at Cherokee Nation. So it's good to hear, and I'd like to be part of some planning group that we might want to do there. I get asked, many times, how come we don't have a facility like that? Well, it's really not that easy. Lisa Pivick has spent years with, I remember Robert Wood Foundation, we first got our grant years ago, 20 years ago, to start doing a feasibility study on where our needs are. But there's a lot of training that goes into this. You just don't build a facility and open up and put weights in it. We tried that with Head Start years ago, and they didn't have anybody that was capable or qualified to manage those workout facilities. But now we do have people that are qualified, and Lisa's made sure that we have some of that. So with that, this is an exciting time to get into preventive health care, public health. Thank you, Madam Chair.
Thank you.
We have air conditioning this place?
Thank you, Speaker, and you're a good example for all of us. A number of you are. I should strive to work out as much as you do.
I try. I'm there every morning.
I know you are.
Okay, Dr. Grimm, thank you for your report.
Thank you.
Do we have any old business to bring before the committee? Any new business? Any announcements? Yes, Councilor Dobbins.
Yes, on June the 14th, the OSU Med School is having a one-day medical school camp at our gym. If you have constituents high school age, they're just trying to figure it out. Well, do I want to go to med school? Is that something that interests me? I don't know. June 14th, they can invest one day and find out what medical school is like. Afterwards, I have a lot of people comment it flips their switch on, but then a lot of them it flips their switch off. And that's good to know. If you're a young person and you're trying to figure it out, that's a good opportunity where you can kind of filter things out. But that's June 14th at our gym.
Thank you,
Right,
Councilor
Sequoia
Dobbins.
Gym.
Is that announced in any other Cherokee Nation forum, Dr. Dobbins?
I don't know. I think it's pretty well publicized. Dr.
Is it?
Nolan just left, but it's
Good.
He's here. That's that Operation Orange.
Yeah, Operation
We've been
Orange.
doing every year with the OSU College of Medicine.
Okay, all right,
We'll be
we're
getting,
good.
if you hadn't heard about it already, we'll be getting information out to
Okay,
everyone.
good.
Okay, any other announcements? Okay, motion to adjourn, motion, seconded? Motion's adjourned. Meeting's adjourned.
Sure.